slide. This shows women in sub-Saharan Africa and South Central Asia. The light blue and the orange sections on the right account for, together they account for more than half of women worldwide with unmet need for modern contraception. So those are the largest portions of women who don't have access to family planning. And of course, generally unmet need is higher among women who are younger. It's harder for younger people to access, and for those who have less education, and also generally those who live in rural areas. And then in overall, it's the poorer women who always have less access than the wealthier women. And we can see that in the next slide. Here we see the difference between the poorest, which is the blue bars, and the wealthiest households in orange in 3 different regions. So in each case, the pattern is the same. It's the poorer who are using less contraception because they have, so that those who are really in need and more in need than others get the first priority, and not assume that everybody has the same need. And often, also there are other issues such as service providers or those who provide either the care or the information. They kind of discriminate either overtly or in attitude and in the way they relate against the poorer and the more marginalized populations. So it's actually quite a challenge to make sure that services are effective. So to summarize about family planning, while worldwide the percentage of women using contraception rose from 47% to 56% in the last 15 years, so there's been progress, there remains high unmet need for family planning. And there is, of course, really an urgent need to make sure that we invest our resources, our attention, our technical expertise, and collaborate together to make sure that these services are made available. And so here maybe I'll just touch very quickly on the issue of funding for family planning, because this is actually quite interesting and a bothersome fact, because as a percentage, funding, the monies going to family planning have decreased out of the total population funding. And yes, here on this slide, down at the bottom, you can't really read it, but that's funding for family planning. And on top, you can see the funding for AIDS programs, for HIV/AIDS and other sexually transmitted infections. So, and over, let's say, the 8 years. And so what seems to have happened, that the funding has gone in a major way increasing for HIV/AIDS, which one can understand, and it is a good thing because, it's a huge issue also, part of reproductive health. But somehow that maybe has meant, or for other reasons, the family planning funding has not only remained low, but has actually decreased. So obviously this is one of our challenges we must address. Also, maybe I can just mention here, although I think you have maybe covered this in the other lectures, that whether we provide these resources will actually determine the future population growth. In part, at least, but in large part. It will basically determine whether the world population overall grows from today's amount, which is 6.8 billion. There are 6.8 billion in the world today, to the estimated UN median projection, which is 9 billion by the mid-century, or to the high projection that UN has made, which is 11 billion. Big differences, either 9 billion or 11 billion. The median projection, the 9 billion, is based actually on the assumption that women in the poorest countries, in countries where this is needed, the most, will have 2 children less than they are having today. And really this requires not only that we expand the programs, but that they are, effectively implemented. So big challenge. But I would say still that what is really crucial to remember, in line with ICPD, is that always behind each number, each demographic figure, there are actually real people, individual women and men and young people making or often prevented from making their own reproductive decisions. So it's not about numbers. In the end, it is about people's choices and people's lives. So maybe I can just illustrate very briefly how this is about people. And one example is about empowering girls in Ethiopia. And this is a real case of today's work, where in that district in Ethiopia, we are partnering with lots of local groups, local government and non-government groups, and also international partners, and interesting also like innovative partners from the private sector. In this case, it's the Nike Foundation, and also the Population Council. Many of you know they do very good work. And we have all joined our efforts and forces to support the families in this community to try to reduce the very high rates of child marriage and early childbearing. They have a tradition of marrying girls basically at, immediately at puberty or even before puberty or right after. So, 10, 11, 12 years old. And it's very difficult to change those kinds of cultural beliefs and practices. But in this is a successful example, at least so far. Here, girls learn how to read and write in this effort. They also learn what we call empowerment skills, life skills, how to negotiate for themselves, and to protect their health and issues, and some skills about financial security, how to do accounting, or how to manage actually bank account. And the fun thing, the wonderful thing here is that the girls who attend the program regularly, they are awarded a goat, because a goat is a very important thing in that community, and it will improve their status, and it will also guarantee returns, financial returns for them on the longer term. So in a way, you're buying the cooperation, but it's in a good way with a very concrete thing. Just to mention, this is of course a new effort, so we need to make sure it continues, but so far, in the very beginning, 700 girls signed up for the program, and the goal is to reach 10,000 girls. So, it's these kinds of efforts that need to be brought to scale, and more of it is obviously required. Because today, there are 600 million adolescent girls in developing world. And obviously, if they are empowered, if they can enjoy their rights, they can be powerful change agents, not only for themselves, but they actually will start a cycle of change for the better in their communities. Now, time is running, but let me just touch very briefly on gender-based violence and harmful practices. In this area, like in everything that is done in population and development, in gender, in